All right, so part 2 of chapter 13. Okay, um, blood vessels. Uh, Okay, the layers and stuff of the tunics and veins. I'm sure you guys know this already, so hopefully we can move through. Okay, aneurysm. Okay, an aneurysm is a balloon-like swelling in an artery or weakened ventricular wall. Okay, mostly in the arteries, and arteries are under higher pressure, so you blow gas easier. Okay, a dissected aorta is a separation between the tunica media and tunica externa of the aorta, and like it starts to separate, and the separation gets larger and larger and larger. Okay, okay, and eventually will tear or burst. Okay, so capillaries again, you guys probably already understand. Um, what you should focus on really is the 3 different types of capillaries and what the differences are in what they do. Okay. Okay. So veins. Again, so arteries have most of the pressure, veins have most of the volume. So to put it another way, okay, uh, arteries are the pressure reservoir for the blood. Veins are the fluid reservoir for the heart or for the blood. Okay. Okay. Varicose veins are enlarged. I'm sure you guys have seen them. They're called spider veins as well. Um, so it occurs when the venous congestion stretches the vein to the point where the valve no longer close. Okay. Deep vein thrombosis. This is an important thing. Inadequate venous flow in a bedridden patient increases the risk of clots forming, and so deep vein thrombosis that can lead to a venous thromboembolism, a blood clot. Okay. Um, so walking around as soon as possible after surgery reduces the risk, as the use of compression stockings and devices that compress the leg and basically forces blood flow back to the heart. Okay. Okay, arteriosclerosis is a common hardening in the arteries. Okay, um, the plaques it protrude into the lumen and then reduce blood flow and thereby increase blood pressure. Okay, and it serves as a site for thrombus formation. Okay, like I said, the smoothness of the wall actually prevents the arteries for the platelets from clogging. Any type of not smoothness induces thrombus formation. So here, the roughness of it all can induce clots. Okay. 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 So here's the stages of development of atherosclerosis. Okay. Okay. I'm sure you guys have heard of cholesterol, but there are 2 types of cholesterol. One's good cholesterol, one's bad cholesterol. The bad cholesterol is the LDLs, low density lipoproteins. Okay. So people consume cholesterol, a lot of cholesterol, so a lot of meat, or produce a lot of cholesterol, that's genetic. They have higher levels of LDLs. Higher LDL level is bad. So this is a bad cholesterol and increased risk of arteriosclerosis. Okay, so this is a LDL. All right. HDLs carry opposite away. So high density lipoproteins carry cholesterol away from the arteries to the liver for metabolism. Okay, and this takes cholesterol away from macrophages and developing plaques. Okay, statins, niacin, all these things increase HDL levels, which is why I take statin for cholesterol, like high cholesterol and stuff. Okay. Okay. Atherosclerosis is believed to be inflammatory disease. So the amount of C-reactive protein is a better indicator for atherosclerosis than LDL. Okay. Yeah. Okay. Ischemic heart disease. Okay. Ischemia is by definition inadequate blood flow. Okay. So ischemia is a condition characterized by inadequate oxygen due to reduced blood flow. Okay. Just reduced oxygen is hypoxia, not ischemia. You learn this one if you guys ever take patho. But ischemia obviously has hypoxia along with it. Okay, but ischemia is worse than just hypoxia. Okay, atherosclerosis is the most common cause of this. Okay, associated with increased lactic acid and production because you're going anaerobic. It's called Taurus. Eventually, necrosis of some areas of the heart leading to a heart attack. Nitroglycerin produces vasodilation. Okay, myocardial cells cannot be replaced by mitosis of neighboring cells. Your heart muscles do not grow very well at all. Okay, usually that area that's damaged is scarred over, okay, by fibroblasts, but not replaced. Okay. All right, this ischemia is the depression of the SC segment of the electrocardiogram, or increase in blood enzymes. Okay, troponin I think that's an isoform only in the heart. So if you see that in the bloodstream, that means your heart muscles are releasing that into the bloodstream. Okay, so here's the ischemia, the S wave. Okay, it's different. Okay. Okay, abnormal heart rhythms. Definitions: bradycardia, slow heart rate, so anything below 60. That's for normal people. Okay, if you're super athletic because your heart volume is larger, and each pump can squirt more blood, below 60 is normal. So if you take like prime conditioning athlete, like NBA players and stuff, okay, their heart rate 50s, 40s, okay, high 40s. Tachycardia is by definition fast heart rate above 100 beats per minute at rest, okay? Like I was teaching people how to measure heart rate, and one girl's heart rate was constantly in the 90s at rest. That freaked me out. But she told me she was tested for it, and she knows that she has a problem. But yeah, okay. 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 So abnormal tachycardia can be due to drugs or just fast pacemakers. Ventricular tachycardia is when the pacemakers and ventricles are out of sync with the atria. That is really dangerous and that can lead to VFib. Okay, which kill you. A heart flutter is extremely fast, 200 to 300 beats per minute, but coordinated contractions. Okay, fibrillation is uncoordinated pumping between the atria and ventricles. Okay. Okay. So you can see the sinus bradycardia. Okay, the sinus tachycardia, the ventricular tachycardia, and then the ventricular fibrillation, where it's not sync at all. Okay, AFib. Okay, atrial fibrillation. The atrial muscles can't effectively contract. The AV node can't keep pace with the atrial contractions. Okay, but some stimulations passed on. So this reduces cardiac output by only 15% because again, gravity pulls the blood from the atria to the ventricle usually on its own. Okay, but you have a tendency to throat clots. Okay, so thrombi, stroke, heart failure. Okay, VFib is when the ventricles can't pump blood, and or they don't pump in rhythm. This is when you need to bring out the paddles and stuff like that. Okay. Okay, the AV node block. Okay, damage to the AV node can be seen through PR interval. Okay, the longer the interval. So okay. So third degree, no stimulation gets through. The pacemaker and the Purkinje fibers is located in the AV node, takes over, but this is slow, about 20 to 40 beats per minute. And learning was a little higher than that. That could be wrong. Okay. So third degree block. Okay. So you can see like the P wave gets through here, like this one doesn't get through, this one does, etc., etc. This one, the P waves have like almost no correlation with the QRS complex. Okay. The lymphatic system. Okay. So I mentioned earlier the capillaries leak. Okay. The fluid is leaked into the capillary bed. The capillary bed, there's lymphatic vessels that are near the capillary bed and they drain into that fluid. Okay. And as it is pumped along, so there's no pump in the lymphatic fluid. I shouldn't say pump. It gets pumped, but it's like every time you move around and stuff, and every time the arteries and veins around it pulse, it pushes the fluid forward. Okay, and so it's a very slow moving system, but that allows time for the lymphocytes to actually generate an immune response. Okay, your lymphatic vessels also transport absorbed fats from the intestines to the bloodstream. Okay. Okay. So all of this stuff. Okay. Lymphedema is the swelling of arm or leg caused by excessive amounts of fluid, interstitial fluid. Okay. This drainage results in blockage or destruction of the lymphatic drainage. Okay. Okay. So yeah. you should, like, as soon as I read lymphedema, like my first thought was elephantitis. You should look up what elephantitis looks like. It makes your it makes your limbs look like elephant limbs. Okay. All right. So done with this. Really short part. So I will see you for the next chapter.